Welcome to the Recycle Podcast, where we discuss everyday issues from a mental health perspective. We are your hosts,
Dr. LaFonya Jones,
Dr. Rashonda Strickland,
and Dr. Nichelle Wall. Now, don't get it twisted. We're not going to be your stereotypical therapist.
What we will be is down to earth, informative, a little spicy, and vulnerable.
All right, interns, turn up the volume, grab your pen and paper. It's supervision time. As a reminder, this podcast is not meant to take the place of a relationship with a licensed mental health professional.
Welcome back to session 30. This ain't that.
Okay, interns, we just realized that we haven't given y'all a real definition of what therapy is.
Our bad.
Yes, our bad. So we are going to kind of do a slight little breakdown and differences between what a licensed professional, a life coach, pastor, and a psychiatrist is. We may give you some other ones, just those are the main ones we're going to start with.
Yeah. So, there are, when it comes to licensed mental health professionals, each state is going to call them something different. But the easiest defaults are you have psychologists, who typically have a doctorate degree. You have licensed professional counselors who can have a doctorate degree or a master's degree. Now, this one, again, is going to be called something different in each state. Sometimes it's licensed mental health professional, licensed mental health counselor. It just depends on where you are. You have what are called LMFTs, or licensed marriage and family therapists.
LCSWs.
Licensed social workers.
Yes. I thought I'd said it. I thought Dr. Strickland was going to finish.
Yes. Yes. Social workers. And then you have some other kind of smaller licenses, chemical dependent, at least in the state of Texas. We're not sure if these particular licenses exist outside of our state.
LCDC, which is a licensed chemical dependency counselor.
And that's associate level.
And then you have an LSOT, which is a licensed sex offender treatment provider. So, which is I think a doctorate level. You have to be at that too, don't you?
It's master's.
It is master's level? Okay. So at least for the state of Texas, those are, and then you have a psychiatrist whom is a medical doctor. And then you have psychiatric nurse practitioners, whom of course are nurse practitioners who are board certified in psychiatry / behavioral health.
Yeah. And they're typically giving you medication. Now, some do some minor counseling, but they typically are the person who prescribes medication.
Yes.
So don't go to your therapist / counselor for medication.
Unless they have another degree and are licensed in that.
But more than likely, they're going to tell you they don't prescribe medication, because we get it all the time. Well, we just came to get medication. No, well, let me refer you out.
And that's a whole other situation. Why are you just getting medication for your symptoms? You don't want to get the root? Okay.
No.
Yeah.
So then, what is therapy? So this is a question, that we typically answer for first time clients, because they're unsure of what they're about to experience. Their only background for therapy, and guys, we'll use counseling and therapy interchangeably here. You probably can find some, if you were to Google, some very slight differences in what those definitions of those two things are. But for the purposes and ease of today's session, we will use those two terms interchangeably, as well as counselor and therapist. We will just kind of put all of those licenses underneath, with the exception of psychiatry. So we usually try to define therapy for clients when they first come in, because especially for first timers, because their background really is generally what they've heard from other people that have may have gone to therapy, or what they've seen in TV and movies,
which is not always accurate.
Mm-mm.
I would say the overwhelming majority of time it's not accurate.
Yeah.
Can you guys think of any accurate scenes that you've ever seen with a therapist, or even mildly accurate?
You know, I will have to say, I probably don't watch this show, but Monk, he was in therapy.
Yeah, he did. That was a good one.
He was a decent depiction of a therapist.
Okay.
I mean, I would say Acrimony is a good one. She just needed a higher level of care.
Mm-hmm.
So it wasn't necessarily that the therapy was not right. She was in the wrong level of care. And that's something that we can go into more detail if that's something that y'all need. And it's another Tyler Perry film where she was with the dude and he ended up being abusive. I can't think of it.
That's like almost all of them.
I know.
Well, it's not a Medea film though. It's a Tyler Perry film.
Oh, gotcha.
And her husband was Lance Gross with his beautifully chocolatey self.
Lance Gross.
Oh, what is that movie called? I don't remember what the
that
movie.
one is not coming to mind.
I think it's like The Marriage Counselor, technically, but I don't think that's the name of the movie. It's after The Marriage Counselor, the play, but I can't think of the name of the movie.
I think I know which one you're talking about.
But I've seen a honest effort from Black directors to showcase Black therapy in a correct light, and I appreciate that.
That's good. That's real good.
Mm-hmm. So one of the things that we try to do with individuals is give them a much more well-rounded definition of what therapy is.
Mm-hmm.
And, one of the things that I talk with my clients about is that, it's not me with alphabet soup behind my name telling you what to do. I'm not going to be giving you advice and, directing your life.
No,
not at all.
That part of this journey is me walking with you. Yes, absolutely. But helping you figure it out for yourself.
Mm-hmm.
I always tell them I don't give advice. I ask questions.
Yes.
And if you want advice, you can go to your friends and family for that.
Mm-hmm.
Because you don't need any degrees or licensure certifications to give advice.
Mm-hmm.
Mm-hmm.
Well, and I think we were all probably taught in school that if you give them advice and it fails, then it's your fault.
Yeah.
But if they talk themselves into their own answer, then they will succeed.
Mm-hmm.
Yeah. And this is not to say that, therapists don't offer suggestion.
Mm-hmm.
But it's always covered or couched with, that expectation that this is, your decision, that, this is a suggestion. Because sometimes clients do struggle with coming up with ideas or coping skills and things like that. So you offer them, a way to kind of get the ball rolling. But again, it's always kind of sandwiched with, this is a decision that you make. You have to figure out which one works for you and decide and go from there.
Yeah.
I think one of the other pieces of what therapy is exploration. Something that I do talk with initial clients about is that we, look at the past, but we don't stay in the past. We work in the present, and we use that to kind of help with what's to come in the future.
And that's one of the things, I think one of the big differences between mental health providers and other professionals is we do we have a foundation of theoretical orientations that we all learn, and what that is basically kind of our guide. So you have different ones. I won't name all of them, but you have like Freudian, which is the one that people typically know is psychodynamic. We have cognitive behavioral therapy, which is CBT, REBT, rational emotive behavioral therapy. We have solution focus. We have reality therapy. It's a lot of them.
Logotherapy.
Mm-hmm. And so all of us, every therapist you have probably has a foundation of one of them, but we pull from several of them. So for me, mine is CBT and REBT. That's my go-to to figure out tools, to think of tools, because I try not to do cookie cutter tools for my clients, but the basics of what even I will create in therapy is gonna probably be cognitive behavioral therapy or REBT centered. And for most mental health providers, that's where they're focused, that like we all have one.
Mm-hmm. So for those that don't know, because this is your Psych 101 lesson today, guys. So what is CBT and REBT?
Which we all do, which is hilarious.
Yes.
Yes.
Like this is gonna be your like lightning round, quick, fast, dirty version.
Yes.
So it's basically looking at the intersection between thoughts, feelings, and actions,
mm-hmm.
and how that kind of dictates life, what you're experiencing, and you basically challenge some of those ideas,
and feelings,
narratives,
mm-hmm.
storylines that we have. And they're called schemas. Again, this Psych 101 lesson. But
I was getting ready to say that, but you was on the roll.
Yeah. But these personal, internal belief systems that we have, these two approaches basically seek to challenge some of those belief systems and help you find a healthier alternative.
Mm-hmm.
I also, yes, I am definitely an REBT, CBT. As I think foundational, as far as technique is concerned.
Mm-hmm.
But my heart is really in existentialism.
Of course it is.
Yes, my heart is in existentialism as well as like reality therapy / kind of like choice.
Yeah.
Choice theory.
I think we all kind of do reality therapy as well.
I mean, it's the one right next to REBT,
mm-hmm.
of course.
Mm-hmm.
I would be in the same boat as the other ladies. Rational emotive behavior therapy and reality therapy are my main ones that I go to, because we are very in your face in a polite way when it comes to therapy. Like, we want our clients to take back their own lives and not be victims. Because a lot of times that's what you end up being when you first start coming to therapy. You
mm-hmm.
have been victimized in multiple different ways. It doesn't have to be like abuse, but you've been victimized in some type of way and you no longer have your own power. So it's about, okay, this is what has happened to me. Now, what do I get to do with it? So I love that those two theories are like that. But my training also is with logotherapy. And for anybody who's wondering what logotherapy is, it technically is the therapy that Viktor Frankl came up with. And Viktor Frankl is the man who wrote Man's Search for Meaning.
It's my favorite book.
It deals with the spiritual concept and being able to transcend the things that are going on around you. And if you hear what I'm saying, it's still a theme with like REBT and rational, not rational emotive, but what is the other one? CBT. So it all goes together. And I actually trained under the president of the Viktor Frankl Institute. So I love that, because I am, as a Christian or as someone who is spiritual, or my other clients who are Muslim or Hindu or whatever, that element comes into play with their therapy, and I can intertwine that in there.
Mm-hmm. So, what you can anticipate, and of course, every therapist/counselor is going to behave differently in their sessions.
You ain't never lied.
As in all professions, you have some great ones and you have some trash ones.
Dumpster juice.
Yes. You know, not all therapists are created equal, and I'm sure that all three of us can provide all kinds of stories that clients have told us about therapists that have, you know, abused them in some sort of way, taken advantage of them in some sort of way.
And this is different from, because I believe all of us have those sessions where we say something that was like, maybe I shouldn't have said that. But that doesn't necessarily mean that you're a bad therapist.
Mm-hmm.
That just means that, you know, it didn't land. And you are always welcome to talk to your therapist about, you know, being offended or saying something that you didn't like. That doesn't mean that you have to fire them. That doesn't mean that you have to quit them. You can just talk about it, especially if you have a good therapist, because some good therapists are hard to find.
Mm-hmm. So what can you expect in a typical first session? What I think, and you ladies comment and tell me if you disagree or agree. I think that's going to depend on your therapist's background. So I think if your therapist has a background in inpatient or higher levels of care, your first session is going to look a little bit different than a therapist that has only ever done outpatient. And I say that because when you've worked in higher levels of care, you are listening for certain types of keywords. You are listening, you are going down and assessing for certain types of things to determine if the level of care that they're coming to you for is appropriate, and what if they need to be in a higher or lower level.
Yeah.
And the rapport, if there's gonna be a good rapport. And sometimes you can't determine it solely on the first session, but you can determine, like, okay, is this gonna be a good fit or not? You know, even to try and get to the second one to see if you can build a rapport.
Yeah. And for everybody listening, rapport is like your vibe, the vibe that you have with your therapist, from therapist to client, client to therapist. That's important, because you're going to be telling your deep, dark secrets and things that are very painful for you to bear to someone else. And you need to have somebody that you feel comfortable with.
Yeah. Because I always tell on my first session, I always let them know at the end, or not at the end, after I do my little spiel, I let them know, okay, so at the end, after we finish your intake, we're going to decide if we're a good fit for each other. If we are, you can schedule another appointment. If not, I can give you some referrals. That way you can find you a therapist that you think will be a good fit. And I say it won't be no hard feelings, and we are okay.
Yeah. So if you've never been to therapy and you are considering it, so like we talked about one of the previous sessions about pre-contemplation versus contemplation. So if you're kind of in the contemplation phase of thinking about going to therapy, you have, just because you went to see somebody, that doesn't mean that that's a therapist.
You can fire them. Just like any other person you hire, you can fire them.
Yeah, something that I definitely try to embody and let clients know is that it is okay to challenge me. It is okay to ask me questions. And I actually tell my clients, I encourage you to do that with all of your practitioners. Part of our job is to answer your questions. Part of our job is to have good bedside manner and put you at ease. You know, it is not just simply because we have all of this knowledge in this one particular area that makes us much more, that makes us smarter, makes us better. You know, it just means that we've developed a certain expertise in a thing, and it is okay to discuss, question, inquire about that thing, because it's your treatment.
Yeah, it's your treatment. It's your life. And I always tell my clients, you're the author of your life. I am not. You're telling me your story from your perspective, and I'm just telling you what I hear.
Yeah, we don't do cookie cutter therapy in this office.
Not at all.
So it is catered to the specific person that is sitting across from us. We want to make sure that we are meeting their needs, and we are an ally or an advocate for the things that they want to accomplish. And sometimes that means we got to go against you.
Yeah, that is true.
Mm-hmm. So ask about your clinician's credentials. If you're unsure what those mean, what are these letters? What is your license type? What is your training? These are questions that are okay for you to ask.
Especially when they have, because all of us have multiple alphabets behind our name.
Mm-hmm.
So you need to ask, because some of mine, people haven't necessarily heard of if you're not in a particular environment. So one of them is a MAC, which is a Master's Addiction Counselor. And if you're not in addiction, then you wouldn't know that.
Right.
So
you just out here macking.
Right. My therapist got a Mac degree. So please ask.
Mm-hmm. Another thing that therapy is it is a walk with your clinician. You and this person are working together. You are coming up with theories. You are coming up with ideas. You are, making connections to certain events, certain people. You are learning strategies, techniques, and gaining insight about yourself, gaining insight about your circumstances. This is something that you do with a person. And which is one of the reasons why I was saying it's okay to ask about credentials, because you want to make sure that the person that you're working with knows how to help guide you through all of this journey. That they know they have a framework that they're pulling from. So it's not simply just you're coming in and we're shooting the breeze and then you leave.
And it is okay for you to ask them what their theoretical orientation is. Now, you may not know what it means when you ask them, but you can ask them to tell you what that means.
Mm-hmm.
Yeah. I think it's important that you get whatever information you need from your therapist in order to put yourself at ease. Now, that's not to say that you get to pry into their personal life, because their personal life has no business in your session. That's from them or from you. Mm-hmm. So you have to be mindful of that. This is not a friend at all. This is somebody that you are paying good money, or your insurance is paying good money to help you with a mental, behavioral, emotional related situation or problem.
Mm-hmm. Absolutely. It's a one-sided relationship. Mm-hmm. Now, while it is when I say intimate, I don't mean romantic or sexual under any circumstances, but it is an intimate relationship because you learn very deep, emotional, sometimes scarring information about a person. But it is one-sided, or if your therapist is acting the way that they've been taught how to act, let's say that. The way that
should be
right, the way that their board of ethics has told them, then it is going to be a one-sided relationship. Now, this does not mean that you may not learn small trinkets of information about your therapist. So, like, for example, a lot of clients know that I'm married. I'm wearing a wedding ring, so it's pretty obvious that I'm married. But sometimes they will come out and flat ask, "Are you?"
And some will ask, "Do you have children?" And depending on why they're asking, I may or may not ask the question.
Answer the question.
Yep. Y'all knew what I meant. I was going too fast.
Absolutely. And it's so funny because I was just talking about this with Dr. Jones yesterday or day before yesterday, that I have a client in particular that likes to ask a lot of questions. And they always preface it before they ask, like, I don't know if this is okay, or, something along those lines. And I finally had to tell this individual, like, look, you are free to ask me anything that you want to ask me. I will discern whether or not I believe that question is appropriate and relevant to your situation, or if you're just trying to be nosy.
Yeah. So like a prime example, and this is not something that you would typically do all the time, but for my particular clients, this is what I did. When I was diagnosed with breast cancer, I let them know that this would be going on. They don't know intimate details about anything, but because I am part of their support system, I have to reassure them that I'm not going anywhere. I have to let them know I am coming back, especially my folks who have abandonment issues. Abandonment can be somebody passing away. It don't have to necessarily be somebody walked out of your life. So that's some information that you could definitely give, but you have to make sure that you're helping them process through that. So I would have when I got diagnosed, the next 2 weeks, most of my sessions, or half of my session, would be about them, and then I would give the other half of the session time for them to decompress and me tell them what is going on and what is about to take place, and if they have questions pertaining to that, then go into detail, because they wanted to know, okay, are you leaving the practice? Are we going to have to go to a new doctor? Things of that nature. And I was like, no, I'm just gonna be out for 2 weeks. So, you have to, it's okay to give certain pieces of information, but it needs to be from the standpoint of, this is about the client. This is not about you, the therapist.
And I had to do the same thing, but I didn't tell them why I was going to be out for 6 weeks. I just told them that I would be out for 6 weeks. For my veteran, I guess, clients, they will be like, you okay? And I'm gonna be fine. I'll be back in 6 weeks. But because I was gonna be gone for so long, I did have to transfer my clients to someone else. Because I was gonna be gone for so long, and I had to help them transition so that they didn't feel like I was being I was abandoning them.
So that's one thing therapy is not. It is not about your clinician. So if your provider is coming in and talking about themselves and spilling their problems onto you and, making it about them, or they are always kind of personalizing what you're saying. And by personalizing, that's just saying that they're taking what you're saying and making it relevant to them somehow. That is not what therapy is. That's what friends do.
They shouldn't be given life stories, because it's not about them. Now, it's another thing if they're saying, okay, if I give an example and they say, I blah blah blah, that's not them interjecting into your life, putting their life into your life. It's them saying, okay, let me give you some perspective. Let me not say, when you do this, they're taking that off of you. So you have to make sure that you're not giving an emotional response to what your therapist is saying either.
Well, and sometimes they may disclose something that is pertaining to what you just said to give you an example. So let's see. So say, for instance, if
so one example I tend to give mine is when I'm working with women or couples, I talk about one of the big things is job distribution in the home. So I do talk about, how my spouse and I, discuss separation of job duties.
Yes.
Yeah.
You know what I'm saying? But they don't know about, he and I had an argument last night about it. No. You know what I'm saying? So it's a very specific example. It's a very stock answer that I give.
It may be an example of like how I set boundaries with my significant other, but it won't be like, but I tell him he got to do this and he got to do, no.
It's the commonality.
Yes.
Yeah. And it helps people realize that this is okay. Okay. Other people do this.
Yes.
Because, a lot of things that you're going to be talking about in therapy are going to be things that you've heard for the first time. And you're like, this some crazy mess or whatever. And it's not actually. It's that we have probably lived a very dysfunctional life before becoming more self-aware about things.
And especially with some of the women that we see in relationships and not having that example of healthy relationships, they need to know if it's normal that, men call from the grocery store and be like, babe, what we need now?
And it's like, dude, I just told you 5 minutes before you left.
Right. Like they don't. And so you that may be a situation where, yeah, my significant other does that same thing. So men tend to do things like that. You may say something like that and it's very general.
Yeah. Yeah. I think another thing to keep in mind is that therapy is work.
Hard work.
Very hard work. I haven't said this to a new client in a while, but something that I used to tell them was, if you have a headache when you walk out of here, then we did something. Because that means your mind was working. Either your mind or your heart was working, one of the two.
And if you leave out of the office and go immediately to your car and start typing stuff in your phone or writing stuff down, we did something because you trying to remember it.
Mm-hmm. So therapy is work. It is not. Now, of course, again, there is a spectrum when it comes to therapy skills and techniques. But in a very general sense, it is not you just coming in and just dumping a bunch of information on a person and then you walk out of the door.
No.
I tell clients all the time, you think coming in here and talking to me is the hard part. The hard part is when you walk out of the door and you have 6 days and 23 hours that I'm not there. Mm-hmm. I'm not there to guide you. I'm not there to challenge that thought. I'm not there to reframe. I'm not there to provide an example. And you have to do this stuff on your own.
I like it when my clients get to the point, not that I need them to have my voice in their head, but I like it when they get to the point where, like, I was getting ready to do this or say this or interact with this person and I heard your voice. Now what you gonna do now? And they'll say it just like I said. Mm-hmm. Now what you gonna do now? Because you already did it. Now what?
Mm-hmm. Mm-hmm. Yeah, my phrase is, so this what we doing? This what we doing? Okay. You therapy is a relationship that is like no other, because it is one of the only places that you will be able to have an unbiased response from someone that is there solely for you. There is no other reason for your therapist to be there.
What would be killing me sometimes is when they say, I'm just so ashamed to tell you this. It's just so embarrassing.
Oh,
really?
my gosh.
We're not friends.
And first of all, I have to let them know, look, it is nothing. I work with sex offenders.
Yeah. Ain't nothing you can say.
Exactly.
That's going to make me be like, oh my God.
No.
All of us have worked inpatient, so
we have seen a lot.
If you shock me, you doing the most, and you probably about to go to the hospital.
Oh, yeah.
So no, you fine.
Oh, yeah. I'm like, dude, I've been stabbed with a pen.
I've been spit on.
Pushed.
Hey.
Kicked.
My first interview, I was chased around a table by myself as an intern, and the dude was 6'4" and I'm 5'2". So we got some stories.
Yes.
Yeah.
Lots.
We have heard the worst of the, well, I don't even want to say it's the worst of the worst. It's just, it's us now. We just hear it now.
So, and I think we all do this, but it is something that I try to make sure that I communicate with my clients. Like, you do not have to be afraid. You do not have to be embarrassed that whatever you are going to say is going to offend me. It is going to shock me. It's going to scare me. Because funny enough, I had a client the other day say that she felt like she might need to quit because she thought she was being too difficult.
No.
And I was like, girl, get off Al Gore's internet with that, because, and I was trying to explain to, this person that if I have a problem with being your therapist, I will tell you. If I believe that I've gotten to a point where I've taken you as far as I can go, if I can't process your trauma anymore, or if I can't give you additional skills to work on, or whatever problem you've come to address with me has been addressed and I don't have the expertise to address the next issue, then I will let you know.
Yeah.
And, we get a lot of that, well, I do, with the LGBTQ community. Because they'll come in, you'll start seeing them, and then they'll say, well, do you have an issue with this, that, and the other? I wouldn't have took you on. That's the point of being in private practice. I don't have to take all the cases. And if you are seeing a therapist who has a problem with the LGBTQ community or any other community or culture, then hopefully they would have told you that during the intake or even when you call, because hopefully that question is being asked of why you're coming to therapy when you call to make the appointment.
Mm-hmm.
If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. It's free. There's certain tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. That's ANCHOR.FM. Yeah, I've had several of my clients tell me that they have seen a therapist before me and they had a problem with some part of their life, or they were trying to convince them that it was a sin, or they were trying to change this about them, or they were trying to say that, like I had a woman who was totally fine with being the weight that she was at, and the therapist always wanted to talk about her weight, and that was not why she was coming in there. So I'm like, you have the right to go find the person that fits you. Now don't go find a yes man or yes woman, because then that's not beneficial, but you find the person that you vibe well with.
Yeah, most definitely.
Like, which is why I say, kind of like what I was saying a moment ago, that coming in and talking with us is not the hard part. It feels like the hard part because you're revealing such, personal information. However, the hard part is the work that you do outside, because the majority of your time is spent outside of the office. Once you have developed a good rapport / relationship with your therapist, you may not like focusing on some of these things, but you enjoy the process. There's a lot of people that look forward to going to therapy. You'd be surprised.
And the thing is, you come to therapy to work on the things that you need to work on. We don't tell you what to, we follow you. So because I had a client a couple of weeks ago who said, we started off working on a certain subject, and then the next time that person came in, she started talking about something else, and she was like, I just realized, like, therapy is just so, like, it's no order to it. I said, it just depends on what you come in with.
It depends on the person.
Yes.
Because some clients that we get are very regimented, and we're going to talk about 1, then 2, then 3, 3A, 3B, 3C, 4. And then we have other who hop all over the place. And that's fine. Like how I start every one of my sessions, and my clients who have me can attest to this. How are you doing? What's been going on this week? And that leads us so many different places. Some people are like, this is what went on. This is what went on. And now let's talk about homework. And then I have other people like, well, this happened. And then that's the major problem. There's not, like I said earlier, you don't have to have a cookie cutter therapy unless that's what you want. I don't recommend it personally, because then you doing treatment plan therapy, and that is ridiculous.
And I don't believe any of the therapists in this office are. I don't think any of us. I think we all follow our client, because what we've been working on may not be what you need to work on today. You may have just had a situation happen yesterday that you need to discuss and work out and work through and figure it out, and we still trying to talk about what we talked about last week, and that's not going to work for you. Then you done came to therapy for no reason.
Yep. I usually start off, and for the clients that have me, they know the first thing comes out of my mouth is, all right, so if it depends on if it's a week or 2 weeks or however long it's been since I've seen them, I say, okay, give me the good, the bad, and the ugly. And they do. They say, okay, well, the good was blah, 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 blah. The bad was da, 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 da. And then the ugly was this, 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 and this. And then it's like, okay. And sometimes the ugly is stuff that's related to a theme of things that we've been talking about. And sometimes, like Dr. Jones was just saying, the ugly is, well, last night XYZ happened. Okay, so I know as the clinician, you always have something running in the background of this is the theme of what we're working on.
Yeah.
And sometimes I need to table that for now because there's a more prevalent issue that they need to address. So then when they come next week, okay, so we talked about this last week. Are we good there? Yes, that's good. Okay, then we can go back to talking about, the overall or overarching issue while you're here.
Yeah, I just started. What's going on? Tell me.
Yeah.
What's up?
I love how we all do the same but different.
Yeah. I had this conversation with a couple that I see this week, and the husband got so upset that his wife brought up something that was not what we were supposed to be talking about today. And I had to tell them it's okay to talk about different stuff. But if y'all feel that is an issue and y'all want to streamline it, we can do that as well. This is y'all's therapy. Let's not have a whole conniption about structure when we need to have a conniption about what's going on in the marriage. So I said, you're deflecting. Come on back now.
So kind of piggybacking on that. So another thing I think that therapy it is a teaching in real time.
Yes.
So some people believe that therapists can't have boundaries. So like if you're
said that whole lie,
but there are people out there that believe it now. Like if you're late to session every week, and I set a boundary for you that okay, you've shown up 15 at the 15-minute mark for the last 3 sessions, like what's going on, we need to talk about that, things like that. Or it's been 3 or 4 weeks and we've been talking about the same thing, and I'm asking about, okay, so what have you done? And you continue to say nothing, or I don't know, or I haven't really thought about it. It's okay. Please understand that therapists have boundaries too. And if we see that something is not progressing, or that there is some, I feel like this is about to be too strong, but I was going to
roadblock.
Thank you. Or I was thinking like a limit that's been set, like your like session time, that's a limit, and that limit is being, kind of broken or tested. I don't know what word I want to put there. That we also can teach in real time a way to communicate how to set a boundary with you in a healthy way.
Yeah.
If you get mad at us because of something that we've said, because that's going to happen sometimes in therapy. Yes. Your therapist is going to say something that's going to make you upset, that's possibly going to hurt your feelings. But we are an individual that you can test all of these skills that we've been talking about in real time, in a safe space, because your therapist is not going to yell at you. We're not going to scream. We're not going to name call. We're not going to degrade you. So you can practice your feelings expression, learn the different words for different feelings, what that impact was on you, and do it in a way knowing that what you're going to get in return is much healthier.
Yes. Now, and if you want old REBT, the original, you might have got some of that, but that's not the way we practice it.
Yes.
Yeah, we don't do that.
No,
that's hilarious.
We walk with, not on.
Yeah.
No, I ain't got that type of energy.
No, I don't feel like
now,
it.
I'm not going to say it don't cross my mind sometime.
Yeah.
And because of my population, sometimes I might have to get with you. But I'm not going to get with you unprofessionally.
Now,
right.
We all do that.
Right.
That kind of goes back to what Dr. Strickland was saying. We have boundaries. There are just certain things that's not going to fly. I tell all my clients, do not talk to me crazy. Do not be disrespectful with me, because I don't have to have you as a client.
Yeah.
The same way you don't have to have me as a therapist or a counselor, I don't have to have you as a client. And there will not be any disrespect tolerated in my office.
Yes.
Because I've had some people jump fly. That's more so really with my my adolescence. And then as soon as you kind of, okay, She cool. I like her. I'm like, we had to do all that for you to like me? Come on now. But we don't really have a lot of that type of problem with adults unless it's more so addiction or
Like Dr. Jones do.
well, I mean, addiction
does, yeah,
or
deals with addiction.
personality disorders, things of that nature, because those are types of issues that break boundaries on a regular. So you have to really be firm.
Yeah, agreed.
Yeah.
I'm thinking about one in
Me
particular.
too. You probably thinking about the same person.
I
You
wish
hadn't
we-
been here.
I wish we could get into that story, but
yeah.
man,
I understand because y'all know when I hear voices get loud,
Yeah, 'cause
I
I-
come out of my office. I have literally had to be like, "Can we hold on 1 second? I'm hearing a commotion outside. And I just want to make sure and check on the safety of everybody in here."
Yeah, they so my room is this is Dr. Jones speaking. My room is the room that it's usually coming out of, and they all like, wait a minute, what? Hold on, just a moment. Let me.
look, I be so focused on what's going on over there. I'm not even paying attention to what's going on in my own room. And I'll be like, hold on, wait, stop. Yeah. So it can, therapy can get lively. It's not always a somber session. It's not always tears. Sometimes it is elevated voices.
Oh yeah,
Yeah, I've had a whole couple screaming at each other, and they don't typically scream at each other. Y'all remember y'all was all outside like, what is going on in Dr. Wall's office? My office ain't never jumping like this. It was jumping that day, and I was just sitting there looking at them like, okay, they need to get this out. I ain't gonna get in the middle of a married couple. They got it together though.
They did.
and sometimes you have to let those types of things happen, because I know I have done the same thing. I've let couples argue. Go ahead. So first of all, because I need to see how you arguing at home. Because if this is how you arguing at home and you yelling and screaming, this is why y'all not resolving
Y'all
anything.
just disrespect.
Because I'm like, y'all done, now y'all comfortable.
Yeah, exactly.
If you'll do it in front of me now, oh, y'all comfortable now. You're not putting on the representatives trying to look good in session.
And I love it when they get to that point.
I think I almost venture to say pretty much like the majority of therapists probably sit back and just watch and say, okay, let me see how they're doing this, because it's good data and it's good information for us to be able to go back and when we reflect on kind of, okay, where did this breakdown happen? What, like Dr. Jones and Dr. Wall were both saying, like, what is your argument style? Do you tend to be critical? Do you tend to name call? Do you tend to gaslight? Do you tend to dismiss? Like, what is
Do
your...
you not argue? Do you just take it?
Are you silent?
Yeah.
Yeah.
So it's good information. So there's usually a rhyme or, to the reason, or no,
Rhyme or reason.
rhyme or reason. Thank you for that. Behind what we're doing. So that's one of the benefits of getting a licensed professional is that there is a systematic approach that's being taken to your care. It is not just us flying by the seat of our pants, just like, hey, I don't know what I'm going to do today, but let's just figure this thing out. There is method to the madness.
And there's a whole ethical board behind whoever your therapist or clinician is. That there are certain things that we have to abide by.
Yeah. We are governed by ethics. The state of Texas.
For us in particular.
Yes. So the only other thing that I was going to add, as far as not necessarily what therapy is or is not, but how disciplines work together. So in particular, licensed mental health professionals and medical professionals, namely psychiatry, which that includes MDs and nurse practitioners, because both of them are prescribers, at least in the state of Texas. Both of them have prescriptive abilities. And our disciplines work side by side. Sometimes we do recommend that, your emotional health has gotten to a point where just doing talk therapy on its own is not going to be as effective, because your emotional level has gotten so high that any information that we try to give to you is not getting in. It's hard to learn. It's hard to retain information when you are in a very heightened or sensitive emotional state.
And that's different from being in a state of needing higher level of care. And the thing with that is that in order for you to know that, you would need to have a trained professional to identify that, because it's a difference between, and I'm just going to use the extreme for an example, it's a difference between having fleeting suicidal thoughts and being suicidal. And a trained professional would know what to listen for, to know, okay, you need medication, as opposed to, no, you need to be hospitalized.
Yeah,
Exactly.
and typically your medication, and this is what I tell my clients, your medication takes the edge off of what you are experiencing, so that you can properly deal with the issues and the problems that you are facing, and you deal with those in therapy. They go together. It's not one or the other when it comes to that, when you get to that place. I'm not a huge fan of someone just getting medication and no therapy. I haven't, in my years of being a therapist, I've never found where that is the best.
Right.
I do agree. I do think that people can get therapy without medication, but I don't think that people need to take medication without therapy.
Yes. And the other thing, now, of course, we are not medical professionals, but if you were to speak to a medical professional about medication, many times these are not meds that are designed for you to be on for the rest of your life. There are a select few type of mental health / behavioral health illnesses or diagnoses that are more likely to be on medication lifelong. But for the most part, for your more situationally based types of depression, anxiety, and things like that, those meds are not necessarily designed for you to be on them 20, 30 years.
More than likely, if you're going to a lower level, we are considered a lower level of care. If you're coming to see us, more than likely, I'm not going to say all situations, but more than likely, you're one of those people, if medication is needed, you're not going to be on it lifelong. More than likely. It's only probably one diagnosis that people would have, but we wouldn't see them.
Oh, yeah. I mouthed something, guys.
Yeah, I did too. So the one that she mouthed, we probably would not see them. The one that I mouthed, we probably would, and so that's the one that would probably need medication lifelong, that don't need to higher level of care.
Yeah.
I agree with that.
Okay. Do we want to do higher levels of care or no?
Let's go ahead and do it, because we still need to talk about the other professions that therapy is not.
Okay. So we've kind of been throwing around the term higher level of care, and we haven't really explained what that is. So just so that you guys are aware, there are essentially 4 kind of main levels of therapy. Your lowest level is called outpatient, which is what we do. Dr. Jones, Wall, and myself, we do what's called outpatient therapy. So it's you and a therapist in an office setting doing weekly, biweekly, monthly therapy. The belief is that you have enough resources and supports to be able to function on a daily basis, and you just need some additional help working through some life issues. If things get a little bit more intense for you, there is something called intensive outpatient or IOP. And that means, you, for the most part, can still relatively function on a day-to-day basis, but you do need some additional supports. So you're likely going to go to therapy a few days a week, maybe 3 days a week for up to 3 hours a day, generally. Of course, every program is different. These are very general numbers that I'm about to give you. So you do what's something called intensive outpatient. So it's a group therapy setting. So it's you and several other individuals, a few hours, a few days a week, because you just need more support than being able to see your therapist once a week. If you need a little bit more because you have something like passive suicidal ideation, so you don't really necessarily have a plan, but you've been thinking about it, and it's just a present, kind of ever present thought, or you've had on the opposite end of that some homicidal ideation, and you're thinking about hurting somebody else. Those are probably the biggest two that would get you bumped up to what's called partial hospitalization, or PHP. So this is, you're going to go to therapy pretty much 5 to 6 days a week for multiple hours a day. It can be anywhere from 6 to 8 hours a day, because you need a lot of supports, but you go home at night, because you do have the ability to still stay safe. You are not a threat to yourself or others, physical threat to yourself or others. So you go home at night, but you spend the majority of your work day basically in therapy. Then there's a level above that. If you are a threat to yourself or a threat to others, and this can include suicidal, homicidal, or psychosis, or severe self-harm behaviors, then you would step up to what's called inpatient. So this is you basically the same as PHP. However, you stay overnight. That's the main difference. So you still go to therapy multiple hours throughout the day, multiple days per week, but you stay the night. If you need even more support than that, the highest level of care is called residential. And so inpatient is usually about 2 weeks. That's about the max you're probably going to be able to get in an inpatient setting. And that's if you have pretty severe symptoms going on. Partial hospitalization is also generally about 2 weeks, and intensive outpatient can be somewhere between 4 to 6 weeks. If you need the highest level, which would be a residential treatment center, this is now you have gone somewhere to live, and you will stay there. That can range. Then that's going to be based off your financial ability, your current symptom presentation, your insurance. There's a lot of things. It can be 30 days. It could be 45 days, 90 days. But you have now needed round the clock care, basically.
Yep.
Okay. So that's your introduction to the different levels of care.
Yes.
That are out there. But like we said, most individuals are going to be outpatient. That's your general, most people are going to fall there, and likely occasionally maybe need IOP. It's when you've gotten to a much more severe level where you need the other levels. And just to kind of round out today's session about what therapy is, what therapy isn't, we wanted to talk about some of the other disciplines out there. So we described psychiatry, therapist / counselor, but there are some other types of ways that you can get help. Thank you.
I was going to say guidance.
I like both of those.
Yes.
And the thing is, we're not trying to slight any field. All are needed, and it just depends on what you need. So we have life coaches, and these are your Alanya Van Zants, and I know some of you are not fans of hers, but that she is a life coach. And basically, a life coach has a certification.
Most have a certification. It is not a
Classically trained.
yes, not, and it's not supervised by a state. So you do run the risk of you don't know what education they've gotten. So do be mindful of that.
So some of you don't like some of the techniques that Alanya Van Zant use, and because they can be some sort of unorthodox ways. And so though some of her the ways, the tools that she used, we would never be able to use as therapists, or we would have to modify those.
Yes.
Because of our ethics board. And that's okay. That's fine, because it works for her. I'm not saying that she's doing something wrong or right, because based on what the certification I assume that she has, that works for her. And some people are able to identify with that, and they're able to make good changes from it. So it's helpful and needed.
Yeah.
Yeah.
But it's completely different from a therapist.
Yeah, I think it's important when you think of life coach, you think of dealing with typically more minor issues that come up. It doesn't necessarily need the in-depth look from a clinical perspective, because you don't want to have psychosis, like you seeing stuff, you hearing stuff, thinking things, and you're going to a life coach. They're not necessarily going to be able to give you the care that you need at that point. It does not mean that you can't have a life coach and a clinician. You can have both. You can have you can have all of these together at the same time. That's perfectly okay. You might be a little therapied and life coached and other things out by the end of the week. So I don't necessarily recommend it, but you can. But life coaching is literally them helping you with, regular life problems. That's not to say that also clinicians will not be doing that as well. Because I know there are some of our clients who come just because, okay, I had a life change. How do I do this? And so that is a more brief form of therapy. But with life coaching, it's important to realize that these are not going to be in the upper levels of care. They are not going to necessarily have someone that they are answering to when they are giving you this care. So it's a very new area when you think about the history of mental health.
Yeah. Yeah, I agree.
And then we have the lovely pastors. I'm trying to think of, so pastors are not therapists.
Unless they have a license.
And thank you. Unless they have a license in a mental health field.
Yes.
Now, they can give you spiritual guidance, but that's not therapy.
No.
And for some, I understand spiritual guidance is definitely needed. I agree with that. That's why I said these things, we all work together. So spiritual guidance is definitely needed, but I definitely agree with Dr. Wall when she said that you can have a life coach, a therapist, and a pastor to spiritually guide you.
But you have to remember what you're going to that person for, their expertise. Their expertise, hopefully, is in spirituality, not in I went upside my wife's head and I need the pastor to tell me whatever. Yes, they can help guide you and steer you, but that's also at the point where you need to have a list of resources for your parishioners or the people that attend your church so that they can also get the necessary clinical help that they need to get, because there's some other stuff going on that just praying it away is not going to do. Faith without works is dead.
Yes, ma'am.
Yeah, you may be having some kind of organic issue going on, like bipolar. That is, that's a chemistry thing inside of your body.
Yeah.
And the trained ear and or eye will not hear what they need to hear what we would hear to be able to diagnose that for you to get something further.
Yeah. And you also have to remember, when you get into relationship with your pastor, as far as needing their help, that is not an unbiased situation. That is a reciprocal relationship, or at least it should be, because that is what the church is for.
Yeah.
Whatever your church is, your church, your temple, whatever. So that person is giving you a list of things to work on based off of the scripture or their holy books that they know. And it shouldn't just be based off of, well, go do this or go do that. Once they start doing that, it then becomes opinion. Or if they start talking to you from a place of a clinician and that is not what their license or their degree and license together is in, then that becomes a problem and they are outside their scope of practice. I can't tell you how many people we have had where they went to counseling with their minister, their pastor, whatever, and it's no clinical information going on. This person is over here about to have a completed attempt on their life. And all the information that they are getting is that they need to pray it away. They need to be a better Christian or whatever the faith is. And they need to go read some scripture.
Yeah.
Yeah, you about to be one less parishioner.
Mm-hmm.
Yeah. Because that's one of the quickest ways to get people to leave church.
Yeah.
Because when that method doesn't work, then they blame God. And that's a dangerous place to be mad at God and blaming him because he didn't help you in your situation.
Yeah.
So.
It's the psychological warfare of perfect.
Mm.
And that happens in church. You know, I'm a whole deacon's granddaughter, so I definitely understand the need for spiritual guidance and spiritual counseling, but I also understand the fact that there is a time for everything. If you know scripture, you know where I'm coming from.
There's a time and a season.
Yes, and you can't let power go to your head if you are in that role of not allowing your parishioners to get the help that they need to get, because I've seen that as well, and it becomes about you and not about them. You a lot of times are the first line of defense for them not to, you know, get worse. And if you are not doing your job, then you might need to step down. And that's that on that.
Ooh, she said a word there.
Drop the mic. She did.
Yeah, I'm serious because that irritates me. Like, my grandfather was a really good deacon, and I think it's because he had a lot of life experience being in the military, growing up in Franklin, Tennessee, with a lot of racism and a lot of, you know, different things that he went through in his family, and then traveling the world and experiencing a lot of different things gives you a different perspective on life as a whole. However, everybody don't get that at their church.
Right.
Sometimes it is, you do as I say, and that's it. That's it.
I've heard that from clients.
Yeah, I've had clients come in several times hurt, and I'm going to be very extreme, damaged from church hurt. And
spiritual abuse is real.
And now, you know, of course, because I do some faith-based therapy, now I have to help them to heal from the church hurt, while also kind of helping them to coddle their faith so that they can get back to where they were.
Yeah.
Without thinking that everybody in the church is like that, or, you know, God hates me, or, you know, things like that. You know, you have to be very careful when it comes to people's internal care. Because if you damage it, it's hard for them to bounce back from that.
You have to teach them discernment, which is ironic. You know what I mean? Because the minister or the holy person is supposed to be teaching them discernment, and instead they have abused it.
Yeah.
Wow. Okay.
But hopefully, you know, if you are going to go to your minister, make sure that you are looking for your spiritual guidance. And then even if they can't give you that spiritual guidance, then you go to someone else in the church, or maybe you need to go to a different church. That's big too. Just because you have been somewhere once, you can fire your church, just like you can fire us as therapists, just like you can fire your life coach or your psychiatrist or whoever. You have to go somewhere that fits
and make
your
sure,
needs.
And make sure you're comfortable with whatever they're saying. If you feel like they're guiding you the wrong way, stop it. Just stop.
Yeah. Don't keep going back. Don't let nobody force you into a compromising position, because that already, I can see that being a problem with your boundaries. And because they're your minister, you should just let them. No, you shouldn't.
No, you shouldn't. Not at all.
Those particular people, church related people, your family, your friends, those are the people that should take the best care of you. Just remember that you can definitely have all of these people as your resources, and they are needed for different reasons. But make sure you pick the one that is best for what your problems are.
Yes.
Okay. So we have a quote today. and it reads, mental strength is not the ability to stay out of the darkness. It's the ability to sit present in the darkness, knowing that the light will shine again.
Must be this volume control.
So, okay, interns, process your notes. Be sure to catch us next session and find us on all major platforms at The Recycled Podcast.
If you're a new intern, be sure to like, comment, subscribe, and share.
Thanks for listening. And remember, we are shifting and reshaping our psyche through healing conversations and connections, one discussion at a time.